My name is Emily, and today I'll be talking about the effects of Duchenne Muscular Dystrophy on the respiratory system. But before we get into that, we need to cover some basics. First of all, what is Duchenne Muscular Dystrophy? Duchenne Muscular Dystrophy, or DMD, is a disorder in which the skeletal muscles progressively weaken. It is an inherited disorder, and it is caused by a mutation in the dystrophin gene, which is located on the X chromosome. And because of its X-linked recessive model of inheritance, it is almost exclusively found in males. So let's break some of that down. Firstly, what is the cause of DMD? As I said before, DMD is caused by a mutation in the X chromosome. This mutation in the dystrophin gene leads to a mutated dystrophin protein, which is degraded by the cells. Therefore, dystrophin is not found in boys with DMD. So, what is the function of dystrophin? First, let's take a look at a normal skeletal muscle. If you zoom in on the membrane of the muscle cells, you would be able to see the dystrophin glycoprotein complex. Here we have dystrophin, which binds to actin, a component of the cytoskeleton. Then we have the components of the dystrophin glycoprotein complex, which are the sarcoglycans, the sarcospans, and the dystroglycans. Finally, we have laminin, which is a component of the extracellular matrix. So, what does dystrophin do? Dystrophin acts like a bridge, connecting the cytoskeleton to the extracellular matrix. It adds strength and support to the muscle. So, what happens if we don't have dystrophin? This is what a skeletal muscle of someone with DMD would look like. If we zoom in on the membrane of the skeletal muscle cells, we wouldn't have dystrophin anymore. So, if we don't have dystrophin, the rest of the dystrophin glycoprotein complex would not be able to stay in the membrane. There is no connection between the cytoskeleton and the extracellular matrix. Therefore, the muscles are weakened and susceptible to chronic injury. What does this look like in DMD patients? From newborns to children of about 6 constitutes the early stage. In this stage, early symptoms occur, such as slower development in motor skills. Diagnosis usually occurs in this phase. The second stage is the transitional stage. The muscles will continue to weaken, and the child will likely start using additional support, such as leg braces and crutches. The third stage is the loss of ambulation stage. Sometime between the ages of 10 and 14, boys with DMD will need to use a wheelchair. The final stage is the adult stage. This stage is characterized by difficulty in breathing as well as respiratory and cardiac problems. This is the stage that we will be focusing on for the remainder of this video. So, now that we've covered the basics, we can get into how DMD affects the respiratory system. As we've seen before, the lack of dystrophin leads to weakened skeletal muscles. As respiratory muscles are a form of skeletal muscles, they are also weakened. This leads to complications such as obstructed airways, as people with DMD will not have the strength required to cough effectively, and an increase in the work of breathing. Additionally, the lack of dystrophin causes a decrease in lung elasticity, which means that the lungs will not rebound at a normal level after they expand from inhalation. This leads to a reduction in lung compliance, which is the lung's ability to stretch and expand. This also leads to an increase in the work of breathing, which can lead to respiratory failure. Respiratory failure occurs when the respiratory system cannot deliver enough oxygen and remove enough carbon dioxide from the body. So now that we've talked about how DMD affects the respiratory system, let's talk about the respiratory symptoms of DMD. Weakened respiratory muscles cause symptoms such as obstructive sleep apnea, in which the upper airway is partially obstructed and nighttime levels of oxygen and carbon dioxide are shifted away from normal. Eventually, the respiratory muscles will weaken to the point where this also occurs during the day. Other problems include atelectasis, or a partially collapsed lung, and obstructed airways, which can lead to respiratory infections, such as pneumonia. So what treatments are available for these respiratory symptoms? At this point in time, while there are general treatments for DMD, when it comes to targeting the respiratory system, the only current options are to manage the symptoms. Looking at respiratory management, what are our options? Firstly, there is non-invasive nocturnal ventilation, which provides the patient with oxygen to help them breathe during the night. When DMD worsens, this breathing support can also be applied during the day. Additionally, there is the option to provide strength training for respiratory muscles, but the evidence that this assists in managing symptoms is conflicting. There is also the option for scoliosis surgery, as severe scoliosis is very common in DMD and can negatively impact the functioning of the respiratory system. Earlier, I mentioned general DMD medications on the market, so let's take a look at how those affect the respiratory system. There are currently 2 types of FDA-approved drugs for DMD, corticosteroids and eteplirsen, and we'll talk about how each of these drugs affects the respiratory system. But first, we need to talk about how respiratory health is generally measured. There are several methods to measure this, but the most common is forced vital capacity, or FVC. Forced vital capacity is the amount of air that can be expelled through the lungs. In DMD, we see a decline in FVC as the disease progresses. FVC is measured by forcefully exhaling into a device known as a spirometer. Now, let's talk about corticosteroids. There is some conflict as to whether or not corticosteroids have any significant effect on FVC. There are some studies that show that they do have an effect, and other studies that show that they do not. This discrepancy could be due to a lack of standardization in corticosteroid treatments across various studies. The other drug that we talked about earlier is eteplirsen. Eteplirsen is an exon-skipping drug, and it is the only non-steroid drug approved by the FDA for treating DMD. In a study examining the effects of eteplirsen on the respiratory system, eteplirsen was shown to stop the decline in FVC compared to a natural history control. Hopefully, as technology and treatments for DMD progress, a drug will be created that can help treat the symptoms of the respiratory system. With any luck, the cure for DMD is just around the corner. Thank you for watching this presentation. Images were created using BioRender, and this video was assembled through Powtoon.